Can you just tell us what has led you to where you are today?
I suppose my background is forensic psychology, and I spent some time working in the police service as a civilian psychologist, and then I moved to working with young people who were involved in substance abuse. Both of those jobs, I would say, were quite stressful because you were dealing with people who were extremely vulnerable and had experienced quite significant challenges in their lives and were struggling really to find their place in the world.
And how do you find having to deal with these type of people yourself? How does it affect you? And say you talked about your family and different things that can affect you. So tell us, how do you deal with this?
I suppose because I'm a mother and I have two beautiful small little girls, and I would go to work in an addiction service, for example, where there was high levels of chaos, children who'd experienced quite difficult starts in life, and then I would go home to my own two little girls who'd had a very nice life, and their perception of the world that we live in and my perception of the world that we live in was quite different. I was very exhausted in the evening time, emotionally exhausted, and if I'm really honest, I don't think I was always able to meet their emotional needs. So when children are very small and they're whingy and cranky and they complain about things that are not going to make the world stop turning, but they're very important to them, my tolerance for that was quite low. So I think it's really important for anyone who works in the frontline service to be kind to themselves and to recognise that what they do is a really difficult job, and it has an impact. It impacts on how you see the world and how you relate with other people. So self-care and large organisations supporting self-care for their staff is extremely important.
Just give us a small insight into secondary trauma if you can.
So secondary trauma is trauma, or sometimes called vicarious trauma. So secondary trauma is trauma that you experience as a result of dealing with traumatic events. It's really understudied, but I think people are starting to pay attention to it, about the impact on frontline services of constantly dealing with trauma and how that affects you physically and psychologically, and it drains on your resources and on your coping skills. So we've just done a study at the moment where we've looked at frontline workers in homeless services. So we're measuring the levels of trauma that they are experiencing themselves, because no human being can go out and deal with another human being in a traumatic situation and not be impacted by that. And I think we need to recognise that much more and make sure that we have the appropriate facilities and services available for people who are working in those positions. I suppose the global statistics show that there has been an increase in the prescription of antidepressants and anti-anxiety medications for children. Certainly there are people who say that we're in the middle of a mental health epidemic, particularly for younger people. The World Health Organization has said that by 2020 our biggest health burden is going to be mental illness and addiction. There's lots of different reasons why the world is sometimes more stressful. People have access to lots of information. You see real-time images of really bad things happening around the world that there's nothing that you can do about, but you're still exposed to it. So children have different stresses than we had when we were younger, and I suppose it's as a consequence there has been recorded increases in prescription medication to young people.
In a perfect world, what way as pre-hospital care providers should we be dealing with them? What would you like to see us doing with how to be treating with these patients?
We have always had people who are unwell, always, going back in the history of time. I suppose we see it a lot more now. People are surviving a lot longer because of interventions, but as a result you can often see more chaos as a frontline provider. I think the best thing that you can do is do your work with compassion and humanity, because all you can do is deal with that person in that moment. And if you're very stressed and you're very burnt out, it's going to reduce your capacity to deal with people who are quite distressed. So having the right support for yourself, being really well, means that you're going to be able to deal with those situations, because mostly there's nothing you can do about it in the moment. Only be there and be as compassionate and have as much humanity as possible, and to try not to let your own anxiety and your own stress take over, so that you can deliver a really good trauma-informed service to somebody.
That's fantastic. Well, on behalf of EMS Gathering, I'd like to thank you for coming along today and sharing your information.